So this is the second of a series of 7 listening sessions that the Pioneer Valley Planning Commission is doing in conjunction with the West Springfield Council on Aging for the Age and Dementia-Friendly West Springfield Initiative. My name is Becky Bash. I'm from the Pioneer Valley Planning Commission, and we have Lori Cassidy here. And the agenda for these listening sessions, generally we do welcome and introductions, and then this is going to be basically a background of the West Springfield Age and Dementia-Friendly planning efforts. Typically we would break into groups and get feedback from everyone, and we hope that members of the community will come to the next several breakout or listening sessions that are coming up in the next couple of months around town. There is a poster and at the Senior Center and also on the Senior Center website that talks about the listening sessions going forward. So first of all, what do we mean when we say an age-friendly community? An age-friendly community is an inclusive and accessible community that optimizes opportunities for health, participation, and security so that the quality of life and dignity are ensured as people age. But it's not just a community for older people. It's a community that's a great place to grow up and grow old, a place for ages 8 through 80. This is a map of some age-friendly efforts that are going on around the state. As you can see, the West Springfield is on the map as one of the age-friendly communities in the Pioneer Valley. All of Berkshire County is designated as an age-friendly region, as is the Cape. And several other communities throughout the region are initiating efforts to become age-friendly. And really what that means is you file an application with the AARP and get a letter from the mayor saying that they support these efforts, and then there's a planning process, and that's what we're in the middle of, is the planning process for West Springfield. A dementia-friendly community is a community that is informed, safe, and respectful to foster quality of life for those living with dementia and their care partners. There are 10 sectors for dementia-friendly community, and I'm not going to go through all of them. You can get the presentation online, but basically these 10 sectors are, it's basically fostering an awareness in all of these sectors: transportation, housing, public spaces, businesses, legal services, and banks and financial services, neighbors and community members, raising awareness among the people in the community, and independent living, helping neighbors and community members understand and support people living with dementia, faith communities, care through continuum, so that there's early diagnosis of dementia and ongoing medical care, memory loss and supports and services, a spectrum of settings and services needed for people with dementia. And I highlighted emergency planning and first response because in addition to the Age and Dementia-Friendly Community initiative that's going on now, the Pioneer Valley Planning Commission is working on a hazard mitigation plan for the town and a municipal vulnerability planning program. So there's some overlap with those programs. This is just a diagram that shows the overlap between age-friendly communities and dementia-friendly sectors, or the age-friendly domains. So there's basically eight age-friendly domains, and I'll go through those in a little bit. But in each domain, there's overlap with the dementia-friendly sectors. So it really makes sense for communities to work on both these initiatives at the same time. Why plan for an aging population? For the first time in history, by 2035, it's projected that there will be fewer children under 18 than there are older adults over 65. Right now, West Springfield is at about 15.3% of adults over 65, which is similar to this diagram. And the number of adults over 60 in West Springfield is about 20% right now, or 23%. So to date, West Springfield has been working on this initiative for a few years. In November 2016, the town was designated by the AARP as the 124th age and dementia-friendly community in the state. There's been a few working group meetings, and there's been a livable community survey, which is still online, and a few listening sessions. Pioneer Valley Planning Commission came on board just this year in conjunction with the Mass in Motion program, which we're also managing for the town. So we're working with the Council on Aging on these series of 7 listening sessions. This is a timeline of the work plan for this year. So we're in the second listening session of 7, and we'll continue these throughout through the end of October. On October 18th, the Council on Aging is having dementia-friendly training for town staff, and anyone is welcome to go. You just contact the Council on Aging. Then we'll be drafting a plan, which will be released in 2020. And as I said, at the same time, there's a municipal vulnerability preparedness planning going on and hazard mitigation planning. So we'll be talking about that in some of the some of the listening sessions going forward. As I said, this is the second of 7 listening sessions. There's going to be another one Monday, September 9th, from 10 to 11 at the Senior Center, and we'll be talking about housing and aging in place. The next one after that is September 23rd. We'll be talking about outdoor spaces and public buildings, and also active living and healthy eating. October 10th, civic engagement, civic participation, employment, and social inclusion. The 22nd, community support and health services, and then the 29th, transportation, communication, and information. And these vary between being hosted at the library and the senior center, so just make sure to check the schedule and the time of where the listening sessions will be. I've mentioned a couple times there are 8 domains of an age-friendly community. This is a diagram that the World Health Organization came up with. And basically it can be divided into 3 groups. There's the built environment, which is outdoor spaces and buildings, transportation, and housing. The social environment, which is social participation, respect and social inclusion, civic participation and employment, and then the community health and support network, which is community support and health services and communication and information. And really communication information sort of spans all of these areas. But the basic idea is that a community needs all of these things to be an age-friendly community. So first, housing. AARP surveys consistently show that the vast majority of older adults want to reside in their current home or community for as long as possible. And they can do that if the home is modified for people aging in place, or if there are housing options that are suitable for people of all ages, including assisted living and long-term care. And in fact, the Livable Community Survey for West Springfield shows that most people thought it was either extremely important or very important to be able to live independently in their own home as they age. It's important to have a range of housing options and housing that's affordable, so smaller units, shared units, accessory apartments, so that people can continue to live in their own homes and rent out a part of their home to make it affordable. They have to be accessible, generally, if there's people with mobility limitations, so housing on the first floor, or there's an elevator or wheelchair ramps. There is a home modification program in West Springfield for people who want to remain in their own home, and it's income specific, but you can contact the town hall and ask about that loan program. And then assisted living and long-term care options. There are a few in West Springfield, but those are good for, if people can't continue to live in their own homes. Another important thing about housing is the location. So you really want housing for older adults to be in town centers. People want to, as they get older, they don't want to drive as much. They have fewer options for transportation. They want to be able to walk to appointments and shopping, neighborhood parks. So it's good to look at housing that's in the middle of town. Second domain is outdoor spaces and buildings. This is really the built environment, and so places to gather inside and out. So parks, green spaces where there's outdoor seating and also accessible buildings where there are elevators, no-step entrances, staircases with railings that can be enjoyed by people of all ages. We look at sidewalks and road crossings to make sure there's ramps for people with mobility limitations, people in wheelchairs, as well as people with strollers. Wheelchair ramps are good for everyone, people on bikes. Parks should have benches and pathways for people with wheelchairs or walkers. And parks and sidewalks should be safe and well lit so people feel comfortable walking around at night. Also, when we talk about the built environment, we want to look at designing with universal design standards, which basically means the design of products and environments to be used by all people to the greatest extent possible without the need for adaptation. So rather than building a sidewalk and putting in a ramp later, build the sidewalk at the level of the road that's being crossed, so there's not a need for any ramps. And just keep in mind people of all ages from the very beginning. This is a photo of the 9/11 memorial, which was designed with universal design standards in mind. It includes exhibitions, cafe, auditorium, and classrooms, and someone seated looking at the statue has the same view as someone standing. The third domain is transportation. Driving shouldn't be the only way to get around, and pedestrians need sidewalks, as I mentioned before, and safe crossable streets. There should be dedicated bike lanes for non-drivers and public transit options. So in West Springfield, there's buses, and there's also private transportation options such as Uber and Lyft. This is a diagram that I got from a slideshow that was given by the Gerontology Institute at UMass Boston. Basically, this shows that from ages 65 through 74, most people are fully mobile. There is a caveat at the top that says age is not an accurate marker of driving fitness. This is just an estimate of where people are at various ages. And then between 75 and 84, people may start having mobility limitations. So they may need some help with transportation, might start taking public transit instead of driving. And then above 85 and sometimes 90, you really need supportive transportation. So sometimes we talk about the last mile. When you talk about older adults, you talk about the last 10 feet, how to get from the car to the door. And in that case, they would need support. This is a continuum of needs and services. So on the left, they call it destination transportation. So people can drive their personal vehicle or use public transit. They can walk to the transit stop. As they get older, they might need curb to curb with taxi, door to door with paratransit. So that's for people with mobility limitations. Volunteer driving programs can be useful to help people get to the door and through the door, and eventually medical escort or ambulance to actually take people inside, so if they have to go to the hospital. In West Springfield, there are PVTA vans available for people on call for people who have mobility limitations, who need special transit. There's a senior center van that takes people over 50, or over 60, sorry, and people who are disabled. And there is a volunteer driver program. So fourth domain is social participation, and so regardless of a person's age, loneliness is often a debilitating health condition, as debilitating as having a chronic condition or disease. Sadness and isolation can be combated by having opportunities to socialize and the availability of accessible, affordable, and fun social activities. So really opportunities available for residents to engage and socialize with peers and with younger folks, just to get them out of the house and not feeling so isolated. The fifth domain is civic participation and employment. So people don't always want to stop working at the age of 65. There should be employment opportunities for older people and also volunteer opportunities. It's really great to get people involved when they're retired and have lots of time and energy and want to get out in the community. So, and older adults should really be engaged in development of policies relevant to the lives of older adults, so in the policies that affect their lives. And employment and volunteer opportunities should be available for people of all ages. And this is an advantage for the whole community. So the whole community benefits from the participation of older people in volunteer and paid work. Sixth domain, respect and social inclusion. Everyone wants to feel valued. So this is really providing intergenerational gatherings and activities to get young and old to get together and to learn from each other. It also, respect and social inclusion also brings in the diversity of a community. So programs that promote ethnic and cultural diversity, where there's interpreter services for people who don't speak English, and translation of promotional materials, intergenerational interaction, and meetings and times and locations that are welcoming for people of all ages. Seventh domain is community and health services. So everybody needs health services in a community, and it's important that those services be accessible and affordable. Access to home-based care services, health clinics, and programs that promote wellness and active aging. The senior center is a great example of that. And access to health care service either nearby or having transportation to be able to get there. Families experience less stress when they're older members of the community or have the support and health services they need. So that's another advantage for the whole community. And finally, communication and information. This is a really important part of the 8 domains of an age-friendly community. Access to communication technology and other resources so that people can connect with the community, families, and friends. Not everybody uses internet, so finding out, what are the best communication devices for people who don't use internet. Even calling them on the phone or visiting people who can't get out of their homes to let them know what's going on and to check on them. And then also translation of materials to encourage participation by all members of the community. So typically these sessions would include a breakout group session with just some general questions about the community. And again, we really encourage people to come to these breakout groups. These are really it's informative for us to learn what people see as needs in the community, and it will help to inform this report on the Age and Dementia-Friendly West Springfield, and help us apply for grants going forward to implement some of the parts of that plan. So with that, we'll break into groups and go forward. But again, the next breakout or the next listening session will be Monday on the 9th at 10 a.m. And we hope to see most of you there. Thank you.